House of Representatives are advocating for vaccine funding to be placed on first-line charge in the national budget to prevent delays in the immunization financing process. This was disclosed by the chairperson of the Senate Committee on Health, Senator Ipalibo Banigo, during the multi-stakeholders technical workshop on the optimization of a sustainable immunization financing model in Nigeria 2.0 held in Abuja. Let's join Elizabeth Kasham for more.
Expressing concern over the country's current health statistics, the chairperson Senate Committee on Health alongside the chairman House Committee on Health Services, Dr. Amos Gomna, stressed that prioritizing vaccine funding just like basic healthcare funds could significantly improve health outcomes.
We saw that this thing was going this way. As legislators, we said we have to step in and do something. We have had in the past where we had the Basic Healthcare Provision Fund, which made a difference to where how primary healthcare is being financed, health insurance and emergency. So we said, why not also have a first-line charge for immunization in particular? If that alone will make sure that we have vaccines always available.
And therefore, delay in releases of funds for immunization will not, when the funds are delayed, sickness and diseases that we vaccinate against will not delay. And therefore, that's why we're calling on everyone that is responsible for timely release of funds for immunization to wake up. And then not just the release of funds, we also need to track those funds and those immunization, those vaccines, whether they actually get to where they are intended to.
Director of Public Health and representative of the Coordinating Minister of Health and Social Welfare, Dr. Godwin Ntadom, assures of effective quality healthcare delivery.
Efficient, equitable and quality health system is one of the drivers or driving force to achieve this, and is to strengthen preventive care through primary health care and community health care, and also by improving quality of care through service delivery.
Chief Executive Officer of the Vaccine Network for Disease Control, Chika Ofo, commended the lawmakers and other stakeholders, stating that placing vaccine funding on first-line charge would help eliminate bureaucratic bottlenecks in financing processes.
Let me tell you something that is very, very important. Do you know that even if you pay for vaccines today, maybe for the rotavirus vaccine, it takes 6 months before you can get it? It's not as if it's a supermarket where you will say, okay, I have my money, let me just go there and I will pick. That's not how it works. So can you imagine that if you have stock out at that time, it means that for the next 6 months, that stock out will remain. Let's not forget that we are the highest zero dose. But here I'm excited because all stakeholders are coming together to say, you know, enough is enough. Let us look for innovative approaches. Let us make sure that this our country, which we call Nigeria, which is our own, will do the needful to make sure that vaccines get to all those that need them.
The multi-stakeholders technical workshop had in attendance key stakeholders including the Budget Office, Ministry of Finance and civil society organizations as they collectively push for a domestically sustainable financing framework that would ensure uninterrupted access to vaccines and immunization services in the country. Elizabeth Kasham, ASO Television News.